Okay, hello, I'm Yvonne Groenhout. I'm a certified critical care and wound care nurse and medical volunteer with the International Medical Corps. I've worked in medical, surgical, neurosurgical, and trauma intensive care units for over 25 years. Not many years ago, my husband and I were at our happiest. We're enjoying good health, empty nesters, fulfilling careers, and then our eldest child, Kaylee, died at the age of 23. We spent the next few years concentrating on helping our younger daughter through her profound grief. But when it came time for us to navigate our loss, COVID-19 hit. When I was watching that crisis unfold, I felt this urgent need to help. A colleague of mine told me about International Medical Corps, and in May of 2020, I deployed to Ingalls Memorial, a highly underserved hospital in Chicago, where I did bedside care with the COVID ICU patients. After this very first deployment, I felt like this was the breakthrough that I was looking for, that I needed. And I was completely hooked. The following year, I assisted International Medical Corps with their COVID vaccination efforts here in Los Angeles and in Corpus Christi, Texas. And then from Texas, I immediately deployed to Haiti to assist earthquake victims in Lacaille. There we provided primary care, and we also trained the local nurses to take over the clinic when we left. In 2022 and 23, I did 3 deployments to Ukraine. I was in phase 1, where we provided trauma care trainings to the medical professionals and civilians throughout various cities in Ukraine. I returned for phase 2 to TOT to train the trainers, and we trained a select group of Ukrainian nurses to become the instructors to again take our place in the program and continue it. And even last week I was just texting with one of the instructors in phase 3, like Jill mentioned, and she's told us it's going absolutely great. That's the one thing that I really admire about International Medical Corps, is that they do, just like the panel was talking, we provide the training for the very communities that need help so that we aren't taking away their jobs. We provide the skills and the knowledge for them to move themselves forward. This past winter, my husband and I were super excited for the Rose Bowl. We're big Michigan fans, and this is on his bucket list, so we were going to do it a big. And so the morning after the official announcement that Michigan would be in the Rose Bowl, I received a call from International Medical Corps. They were deploying the field hospital in southern Gaza, and would I go help set it up? My husband took one look at me and without hesitation said, "Go, there will be other games." So I spent the next 5 weeks volunteering in Rafah, the lone American in that group of Jordanians, over Christmas and New Year's. We had very difficult and extremely challenging circumstances. We were seeing, we would go to the hospital and there would be 50 people lined up at the gate. We were seeing hundreds and hundreds of people sick and injured. It was heartbreaking, some of the cases that we would see, but extremely rewarding to be privileged to serve there. And all the people that I met were absolutely wonderful, the people that stayed to help. In the end, back at home, my husband donated what we would have spent on our Rose Bowl extravaganza to International Medical Corps' Gaza relief. And we agreed that that was both time and money better spent. Plus, Michigan won the Rose Bowl. People will always ask me, your husband lets you do this? And my husband will always laugh and say, I never let her do anything. But, she does not need my permission, she needs my support, and I'll support her in whatever she does. And I'll tell you, this is what I want to do. I believe wholeheartedly in the mission of International Medical Corps. I have seen over and over the impact that we make, and that's why whenever they call, no matter what, I will be ready to go at a moment's notice. Because I know from experience that we are the best. So, there was a time when I couldn't volunteer like this, work, kids, life, and all I could do was donate money and hope that it was making a difference somewhere. But now that I can volunteer my time, I can tell you firsthand exactly where that money goes and that it is making a huge impact. For one, International Medical Corps reaches so many people. When I was here in LA, we did, I think, 1,000 vaccinations in one day. And on day 2 in Rafah, we were seeing 500 patients. It was incredible. And you just can't do that without support, without money for supplies, medicine, equipment, money that is spent wisely for resources that are needed, that can have the widest impact for the most people. Your support gave a mother in Gaza an inhaler for her child, and she told me she was so happy because it was so difficult to hear her child struggle to breathe at night. Your support gives something as simple as an antibiotic that can be the difference between saving or losing a limb. And your support enables me and other volunteers to serve in the places that were needed the most. Your support also enables us to be a compassionate soul for people that need an empathetic ear. And your support provides critical training for others to become self-sufficient. In places where there is so little, these little things make a huge difference. So I want to tell you, thank you so much for supporting this amazing, awesome organization and ensuring that we can continue to do this vitally important work. I want to personally thank you for allowing me the privilege to serve our fellow humans. And please know that when you give from your heart, whether it be time or money, you are truly making someone else's life better and making this a more loving world. So thank you so much.